Colon cancer or colorectal cancer is a form of cancer that develops from the cells that line the inner wall of the colon or rectum. In this video, we're going to delve into what colon cancer is, followed by the most common signs and symptoms that show up, and lastly we'll explore the reasons behind their occurrence. What is colon cancer? Colon or colorectal cancer is a cancer that affects the large intestine, also known as the colon. The large intestine follows a sequential path, beginning with the ascending colon, followed by the transverse colon, descending colon, sigmoid colon, and concluding with the rectum. Therefore, colon cancer can affect at any segment of the colon, including the rectum. Colon cancer initiation involves genetic mutations in colon cells, spurred by factors like genetics or the environment. These mutations can activate cell growth-promoting genes or deactivate tumor-suppressing genes, allowing abnormal cell division. These abnormal divisions will result in adenoma formation, often originating from benign polyps on the colon's inner lining. Within these polyp cells, additional genetic mutations occur, leading some to transform into cancerous adenocarcinomas. In the progression to cancer, adenocarcinomas grow, infiltrating deeper layers of the colon wall and potentially spreading through blood or lymph vessels to other body parts, a phenomenon known as metastasis. So, a malignant tumor of the colon originates from a tumor that was initially benign and has evolved over several years. This is why regular colonoscopy checkups are fundamental for early detection and prevention of progression to full-blown cancer, especially in cases with a family history. Colon cancer or colorectal carcinoma is one of the most common cancers in the world. It is ranked third after breast cancer and prostate cancer. Colorectal cancer is the third leading cause of cancer-related deaths in both men and women. Advanced age, a family history, especially if a parent, sibling, or child has previously had colorectal cancer, individuals with colorectal polyps, and those with certain intestinal conditions like ulcerative colitis or Crohn's disease are at a higher risk for developing colorectal cancer. Due to this increased susceptibility, regular colonoscopies are recommended for early detection and preventive care. Signs and symptoms of colon cancer. Signs and symptoms of colon cancer can vary, and it's essential to recognize that the condition can be asymptomatic in some cases. However, when symptoms are present, they can be diverse. Abdominal pain is a prevalent symptom, often resulting from partial or complete obstruction by a tumor or mass. Another cause of pain may be the invasion of the peritoneum by the tumor. Changes in bowel habits are also common, with alterations in stool consistency and a sensation of incomplete evacuation. This is logical since a tumor in the large intestine can affect the passage of stool, leading to thinner stools and a feeling of incomplete evacuation, particularly if the tumor is substantial and obstructs part of the stool. It's crucial to be aware of these potential signs for early detection and timely medical intervention. Another symptom associated with colon cancer is anemia, which results from excessive and abnormal bleeding. Unexplained weight loss is another potential symptom linked to anemia, which causes decreased appetite and is commonly observed in various types of cancer, not exclusive to colorectal cancer. Approximately one-third of cancer patients experience involuntary weight loss, leading to a condition called cachexia. Cachexia is a severe syndrome associated with cancer, characterized by significant weight loss, metabolic alterations, and muscle atrophy. Importantly, cachexia cannot be effectively treated by simply increasing nutritional intake due to the increased protein and energy needs imposed by the disease and its treatments, making it a significant indicator of disease severity. Another symptom associated with colon cancer is a change in bowel habits, presenting as constipation, diarrhea, or an alternation between the two. This alteration in bowel habits is particularly noteworthy for individuals who have experienced a consistently normal transit throughout their lives and suddenly observe a change. Additionally, the presence of blood in the stool can be a potential warning sign. Bright red blood in the stool, known as hematochezia, may indicate undigested blood mixed with stool, resulting from the tumor's development in the intestinal mucosa, potentially causing bleeding. Melena, characterized by black-colored stools, suggests the presence of digested blood in the stool, indicating bleeding within the digestive tract. Recognizing these changes in bowel habits and stool characteristics are also crucial for identifying potential signs of colon cancer. Fatigue is another crucial symptom associated with colorectal cancer, presenting as a pervasive sense of tiredness. Additionally, a palpable mass may develop, which is a potential sign of colon cancer, particularly when accompanied by intestinal obstruction. Intestinal obstruction can occur due to the tumor's mass, leading to symptoms such as constipation. The severity of constipation is contingent upon the tumor's size, with larger tumors potentially causing complete obstruction and the absence of stool. Complete obstruction is a critical and urgent factor, indicating the seriousness of the condition. In conclusion, the manifestations of colon cancer vary from person to person and depend on the stage of the disease's progression. The symptoms become more diverse as the cancer advances, especially when it reaches metastasis, the spread of cancer cells beyond the primary site. This migration can affect various organs, leading to additional symptoms. Common sites of metastasis include the liver, lungs, and lymph nodes. This video highlighted the most frequent signs and symptoms of this pathology. Thank you for watching, and if you found the video helpful, please like and subscribe to not miss future updates. See you next time for a new video.